Good morning, everyone. On behalf of Mercy University School of Medicine and Children's Healthcare of Atlanta, welcome to the 2024 Children's Healthcare of Atlanta Rural Scholars Luncheon. I'm Jean Sumner, Dean of Mercy University School of Medicine. Today is a celebration of continuing improvement and our commitment to progress through improving healthcare in rural Georgia. These incredibly talented young people, medical students, and family therapists are committed to living and practicing in a rural, medically underserved county. They are blazing a trail that will become a path, and eventually, I believe, will be a 4-lane for others to follow. We are proud of them and deeply grateful to Children's Healthcare of Atlanta for their leadership and support of this scholarship that makes the path less difficult. Thank you for joining us on this very special day. I'd like to mention that a large number of students and faculty were delayed on I-16. There was a catastrophic wreck outside of Savannah. They were not involved in it, but they had to try to find their way here, and we don't expect them until noon. So if people walk in or a little later, we'll save their food. I'm sorry they're not here, but that's why we have some open spaces. I'd like to invite Eva Proles to return thanks. She's a second-year medical student and president of the Student Christian Medical and Dental Association. Afterwards, please enjoy your meal.
Let us pray. Heavenly Father, thank you for your many blessings which you have given us. Thank you for bringing us together to recognize the hard work and dedication of this year's Children's Healthcare of Atlanta Rural Scholarship recipients. As we honor each scholar, both past and present, help us to remember all the glory belongs to you. Thank you for the friends and family who came to support and encourage these individuals and propel them forward into service for others. Without their love and support, this day would not be possible. God, I pray that each and every one of these students utilize their gifts and talents that you have provided for them as they go out and serve. Psalm 90:17 says, "Let the kindness of the Lord our God be over us. Make the work of our hands last." Make the work of our hands last. I pray that you make the work of each and every one of these students' hands last. Help us always to remember everything, to do everything with a grateful heart, and to be intentional with our work for you. For it is you that has instilled these individuals with a passion to serve others with the work of their hands. Amen.
Please continue your meal. We'll go ahead and start with our program. And feel free to eat your dessert as we talk. The mission of Mercy University School of Medicine is to educate physicians and health professionals to meet the primary care and healthcare needs of medically underserved Georgia. Georgia is a great state, but the citizens of rural Georgia lack access to quality health care. You can lay blame and discuss reasons, but this initiative is about solutions. Over half of the rural counties in our state have no pediatrician. Many that do have one pediatrician. These scholarships will change that. The Children's Healthcare of Atlanta Rural Scholarships are awarded to students who are committed and determined to return home or to another rural area to practice pediatrics or family therapy that includes children. As you know, Mercer School of Medicine students are Georgia citizens. For our rural pediatric scholars to be eligible for the scholarship, the student has to be enrolled or accepted into enrollment in our 4-year MD program and have strong ties to rural Georgia. The scholarships cover 100% of medical school tuition for a maximum of 4 years. 10 scholarships are awarded annually. The awards are renewed annually for the recipients who maintain satisfactory academic progress, actively participate in the medical school's rural health research and leadership development activities, and display continued commitment to rural Georgia. Upon completion of a 3-year pediatric residency, students fulfill their service commitment with 4 years of continuous full-time medical practice in a medically underserved rural Georgia county. They must accept Medicaid patients. For our family therapy scholars to be eligible for the scholarship, the student must be committed to practicing family therapy in a rural Georgia community for 2 years, with an emphasis on families with children and develop additional skills to work with autistic children. The Marcus Autism Center is part of Children's, is one of the most respected autism centers in the country. These scholars will have the opportunity to learn and experience visits to Marcus. Scholarship recipients are selected by the Physicians for Rural Georgia Scholarship Committee based on the applicant's strong ties to rural Georgia, character, leadership qualities, community involvement, and characteristics that indicate a high likelihood of continuing to serve rural Georgia once the scholarship's medical and family therapy service commitment has been fulfilled. Today we celebrate 10 2024 selected Children's Healthcare of Atlanta Rural Pediatric Scholars. Scholars, I'll call your name and class, but please remain standing. Jimmy Asbell, class of 2026. Christian Castile, class of 2026. Addison Clark, class of 2028. Logan Dominique, class of 2028. Anna Catherine Gates, class of 2027. Haley Holloway, class of 2028. Ritiv Saravea, and I'm sorry if I messed that up, class of 2028. Jordan Simmons, class of 2028. Trace Steele, class of 2027. And Keisha Willis, class of 2028. Will all the currently enrolled Children's Healthcare of Atlanta Rural Pediatric Scholars who were named last year and are present please stand and be recognized, and welcome your fellow scholars into the ranks of those who are committed to change the health status of rural Georgia. You may be seated. Thank you. I think this is a special day for a lot of reasons, but one is because we have now scholarships from Children's for family therapy scholars. If you live in this state and anywhere, but particularly rural Georgia, you realize the need for mental health services. Though the School of Medicine houses the Marriage and Family Therapy Program, and I know that I am biased, it is one of the strongest family therapy programs that I know of. They turn out great graduates, and so I'm excited about the potential that this offers rural Georgia. I will call the names of the 5 scholars we've selected this year, so please stand and be recognized and remain standing. Kiana Brown, class of 2024. Audrey Pugh, class of 2024. Lakeisha Robinson, class of 2025. Haley Troop, class of 2025. Haley Waters, class of 2025. Congratulations. You can be seated, sorry. Any organization needs visionary leadership, and we're fortunate at Mercer to have a president who cares deeply about the work the School of Medicine does, and under his leadership, the School of Medicine is thriving. Today, we not only recognize our scholars, but we also recognize Mercer's leadership, who helps us serve better this state. President Underwood.
Dr. Jean Sumner is one of the most impactful medical school deans in the country. I think she is the most impactful medical school dean in the country. Presidents exaggerate. Sometimes we make things up. But I'm neither exaggerating or making anything up when I say that Jean Sumner is a great, impactful medical school dean. Our mission, going back to our founding, was to address rural health care needs in the state. Jean was in our first class at the Mercer School of Medicine and has shared a commitment to that mission going back to the early 80s as a student here at Mercer. I would say that under her leadership, we have raised our sights as to what can be accomplished. I think we truly believe that in our lifetimes, it can be the case that your access to quality health care in the state of Georgia will not depend on what your zip code is. I think that's fair. So we can do that, and I want to congratulate the 15 new children's healthcare scholars who we've recognized, the 10 future pediatricians and the 5 future marriage and family therapists. You all are going to be a very important part of us achieving this aspiration. I want to congratulate you for your selection as children's healthcare scholars. I want to congratulate your parents who are here in many cases with you for raising such outstanding, committed young people. And I want to thank the scholars for your commitment to this work, very important work. We've got a number of our colleagues and friends and partners from Children's Healthcare with us today. Linda Matzagite, who's the Chief Administrative Officer of Children's Healthcare. Linda, thank you for joining us. Mark Welsh, who's the Vice President, Chief Advocacy, and Chief Diversity Officer of Children's Healthcare, who's also with us today. Thank you all for joining us. We have some of our state legislators here. I just want to thank you all, past and present legislators. We couldn't do our work without the support of our partner, the state of Georgia, and we're grateful to the state of Georgia. I know we have some other folks from Children's Healthcare with us. If you're from Children's Healthcare, would you stand and let us thank you all for your commitment to this partnership? We have some great pediatricians with us, of course, at this event. I'm sitting here looking at the dean of our Columbus campus, Don Nakayama, who's one of the renowned pediatric surgeons in the country. And, of course, Dr. Fortenberry, who's been with Children's since 1992, has had an incredibly distinguished career in pediatrics as a pediatric intensive care specialist. He's among the most impactful pediatricians in the world, both through his work with patients over his many years at Children's, but also with his work in leading this world-renowned healthcare center. He serves as the Chief Medical Officer of Children's. He served in that capacity for 4 years. He's very committed to this partnership and looking for ways that we can even have more impact than we're already having. So I'd like to invite Dr. Fortenberry to bring a few remarks. Thank you. Thanks for doing this.
Thank you, President Underwood. Those were incredibly kind words, and it's a chance to say thank you as well. And we were just talking a little earlier, and I was as a Georgia native and did my medical school here in Georgia as well before Mercer existed. So it's been a few. Before the medical school, not the university. Yeah. I was born in 1869. No. Thank you for clarifying that. But to see what's happened through Mercer University, through the medical school, to see the reach of Mercer spread around the state in Columbus and Savannah, and of course here. It's just incredibly exciting to see the impact that you're having. And thank you, President Underwood, for your leadership there. And it's a chance to say thank you. One of my classmates, actually from MCG back in 1984, Dr. Baxter, is dean in Savannah now. So thank you. Also, thank you for my tie, my Mercer tie. President Underwood gave it to me a few times ago, and I love it. I love the color, and I really appreciate it. On behalf of myself, Linda Matzekite, the entire children's team that you just heard from or had stand today, I wanted to thank you. I want to thank you, Dean Sumner, for all of the work that you have done, and the teams with the Rural Health Innovation Center who have helped develop this incredible program and partnership, and also your friendship over the past year. I know Donna Highland, who couldn't be here today, has become fast friends with you and just had incredible words through the years of getting to know you and work with you and work on this partnership together. I also wanted to say thank you to Eva, who gave the invocation. The psalm that she shared was perfect for this time today, which is to make the work of our hands last. And as I got to meet some of the our marriage and family therapists and the pre-students today, and heard class of 2028, that really hit me. We've got work to do, but the work of our hands is going to last thanks to you who've committed, and you who committed earlier. It's hard to believe it's been a full year since Children's and Mercer came together in this very place to announce a major initiative that would expand access and strengthen pediatric health care for children in rural Georgia, with a focus on improving access to pediatric care close to home. During that announcement, Dean Sumner articulated a list of priorities. Among the most important, she was adamant about the urgent need for more pediatricians throughout Georgia. So to help increase access to pediatricians in rural counties, Children's has been proud to partner with Mercer and to fund full tuition scholarships each year through a program at Mercer University School of Medicine for medical students specializing in pediatrics who commit to serving in rural Georgia for at least 4 years after residency. I'm thrilled to be here today to recognize 3 important groups of scholars. One is our 2024 Children's Healthcare of Atlanta Rural Pediatric Scholars. New in 2024 are Marriage and Family Therapy Scholars. And then I also would like to welcome back last year's Children's Healthcare of Atlanta Rural Pediatric Scholars from our inaugural class in 2023. Thank you for your commitment to kids and for serving as that charter class, that first class of scholars. You've helped us understand this program and how to develop. The inaugural class of scholars came in Children's last June and toured Eggleston Children's Hospital and the Center for Advanced Pediatrics, which is our ambulatory pediatric center. Their visit was emblematic of what we aim to do through this scholarship program, to create lifelong connections where we can work together and learn from each other. We want to support each of you with our pediatric love and help you form relationships you can use throughout your careers here in Georgia. We're all part of a team coming together for Georgia's kids. Those energetic and inquisitive students who visit us this summer reminded me of a former Eggleston resident who I got to see, I think last time, Dr. Jennifer Tarbutton, who's very involved, as most of you know, with Mercer. Her insight has been invaluable as we look to support our rural communities. Not only is Dr. Tarbutton a role model pediatrician, she's a role model person. And she's committed to this school and this state like no other. She understands the importance of building professional relationships across the state, and the connections she's formed throughout her career continue to benefit her patients to this very day. I'm proud of the physician that she has become and the small opportunity to get to know her as a pediatrics resident at Emory. She's one of the best residents I had the honor of working with, and I'm sure she would want each of you to outdo her. We're so grateful to all of the scholars for your commitment to the children and families of Georgia. You recognize that kids are not simply little adults. They need a special kind of care. You are filling a need in our communities and will have a tremendous impact on the families who will come to rely on you. I believe this work will be incredibly rewarding as you see your patients grow and mature in the community where you work and live and raise your own families. More than 60 of Georgia's 159 counties do not have a single pediatrician, as Dean Sumner mentioned. And we are facing a severe shortage as well of mental health care providers. According to the National Alliance on Mental Illness, in 2021, 68% of Georgians aged 12 to 17 who had depression did not receive any care in that last year. As a pediatrician myself, I find the current situation both heartbreaking and motivating. We know it's time for action, and this scholarship program is part of that action, helping fulfill a desperate need for pediatricians and marriage and family therapists across the state. Before we know it, some of our first scholars, Dr. Nellie Young and Dr. Jonathan Edgy, are they here today? I had to come in a little late. They're completing their pediatrics residencies at Morehouse and the University of Florida College of Medicine in Jacksonville. So they're the first, the pioneers of coming out of this program. They'll begin practicing in one of our rural communities. We're so proud to be a part of their journey. I believe this scholarship program is the start of something big and transformative. Transformative for our medical students and for our state. Thank you again for your commitment and dedication. I want to personally wish you the best of luck and excitement in the next step of your journey. And we look forward to working with you as Children's Healthcare of Atlanta as you begin your careers. Thank you again.
Thank you, Dr. Horton, for those kind words and for your partnership. We have two student speakers today. That's great, a pediatric scholar and a family therapy scholar. I'd like to introduce first Mackenzie Best, a second-year medical student from Bon Air, Georgia. Mackenzie was awarded the Children's Healthcare of Atlanta Pediatric Scholarship in 2023, and upon completion of her medical education is committed to practicing in rural Georgia. Mackenzie is married, her husband Carson, and they have two children, Josiah and Julia. It's a pleasure to introduce Mackenzie Best.
Good afternoon. I am humbled and deeply honored to speak with you all today. I am Mackenzie Best, a second-year medical student and a double bear. On behalf of all of the Children's Healthcare of Atlanta pediatric scholars and the Marriage and Family Therapy scholars, thank you. We are so grateful for this scholarship and opportunity. I want to share a little bit of my story. It starts with my childhood. My father was known as the praying doctor. He routinely asked permission to pray with a worried patient. My mother is exceedingly generous and loves on everyone she meets. My parents exemplify selfless service. As a young child, our family lived in Toccoa, Georgia. My father practiced internal medicine at a small clinic there. My family loved this small town. My parents always speak very fondly of the tight-knit community and the warm kindness of the people there. My father went on to complete a fellowship in cardiology, and we moved to Watkinsville, Georgia. He worked there for many years, but 6 years ago, he felt drawn back to a more rural area, choosing to work in Livonia, Georgia. My parents not only taught my sisters and me to work hard and to serve others, but they modeled it for us as well. Their example, watching the difference they made, inspired and solidified my desire to practice medicine in a rural, underserved area. I knew I wanted to be a physician at the age of 13. I went on a mission trip with my church to an isolated village in Mexico, where I saw firsthand the health disparities that come with poverty and inadequate access to health care. The trip changed me. I felt a calling to offer hope and healing to people who needed it most. I have always loved children and wanted to work with them in some way. After having my own children, I realized the immense life-changing value of having a caring, well-educated general pediatrician. With the birth of our first child, a son, I was a very anxious new mom. I completely doubted my ability to care for him. My children's pediatrician, who some of you may know, Dr. Jessica Ford, a Mercer School of Medicine graduate, recognized my anxiety and poured words of comfort and encouragement. She helped us learn to become good parents. She educated us and developed a path toward good health for our child. My husband and I made it, and so did our second child, a beautiful, feisty girl. Dr. Ford has not only taken excellent care of my children over the years, but she has also counseled and taken excellent care of my husband and me. That's when it clicked for me. That's when I knew that I would be a pediatrician. A pediatrician for the kids, of course, but also for the families. When I tell some people that I'm going to be a pediatrician, they usually exclaim, "Well, the kids are great, but ugh, the parents." And I think to myself, exactly, it's about the child and the parents. There can be no healthy child apart from a healthy family. Whatever that family works out to be. A good pediatrician cares for the whole family. I want that same opportunity to care for children and to reassure and empower their families. This program, this scholarship, has made pursuing that hope and dream possible. This scholarship was literally an answer to prayer for my husband and me. We had been praying and thinking about how we would pay for medical school, knowing that we wanted to live and work in a rural county. We knew that paying off student loans would be challenging. Then, almost like a miracle, this scholarship was announced. I was just amazed at how it was seemingly handcrafted for our dream of opening a private practice in a rural community. The Children's Healthcare of Atlanta Rural Pediatric Scholarship will allow me and my fellow students the chance to pick where we want to practice, where we are needed most without student loan debt. How many medical students can say that? I have become increasingly interested in developmental and behavioral pediatrics and want to learn how I, as a general pediatrician, can support and care for families that have children with developmental disabilities. The strength of my education at Mercer, coupled with the experiences and support from Children's Healthcare of Atlanta, gives me a chance to develop a broad range of skills. I hope to help bridge the gap in care that many families who have children with disabilities face. Georgia's rural children in need of an evaluation for autistic concerns have nearly an 18-month wait. And this is even if they have the financial resources for access. This delay in diagnosis and treatment creates a long delay during a critical period of development when younger children would benefit from aggressive interventions. There are exciting new diagnostic tools and policies in the works for autism diagnosis. Bringing such technology and skill to rural areas could expedite the path to treatment sooner and bring significant benefit to the child and hope to the family. With the right preventive guidance and support, most children will grow up healthy. Pediatric subspecialists will be needed for some children, but these are rare in rural Georgia. An appointment with one usually means long hours of travel. Having a general pediatrician who makes a diagnosis, coordinates care, connects you with the right specialist, and then follows up with you means better outcomes, decreased family stress, and money saved. Our daughter needed strabismus surgery for both eyes last year. The surgery was done at Children's Healthcare of Atlanta. Our experience was amazing. The surgeon and the staff were all absolutely wonderful. But we came home knowing that we had a local pediatrician who knew us, cared about us, and would help if we needed anything. Chronic disease is increasing in children. Over the last 20 years, type 2 diabetes has doubled in children. It is projected that by 2060, type 1 diabetes will increase by 65%, and type 2 diabetes will increase by 673%. Think about the children in rural Georgia who have no physician, much less a pediatrician. There are 65 rural counties out of 120 that have no pediatrician. This limited access to care delays diagnoses, treatment, and causes worse health outcomes. Without healthy, thriving children today, we will not have healthy, thriving adults tomorrow. Children are our future. Georgia needs more generalist pediatricians practicing in rural areas. Nothing is more important in healthcare than to start a child and guide them on the path to good health. In doing this, we impact families and whole communities. General pediatricians fulfilling this role in rural Georgia will help to grow healthy Georgians. Mercer University School of Medicine and Children's Healthcare of Atlanta are transforming rural health for a brighter future. On behalf of my colleagues and fellow children's scholars, we are deeply grateful for the support and your commitment to rural Georgia. We will not let you down. Thank you.
Thank you, Mackenzie. I'd like to now introduce Lakeisha Robinson. Lakeisha is a first-year marriage and family therapy student in the master's program. She is from Macon, Georgia, but works presently in Jones County. Lakeisha was awarded the Children's Healthcare of Atlanta Rural Family Therapy Scholarship this year, and upon completion of her education is committed to practicing in rural Georgia. It's a pleasure to introduce Lakeisha Robinson.
Thank you, Dean Sumner, for that gracious introduction. Good afternoon. I am Lakeisha Robson. I'm a first-year marriage and family therapy student. I am deeply honored and incredibly humbled to speak to you today on behalf of my fellow students. I am grateful for the opportunity to attend the family therapy program at Mercer University School of Medicine. I chose Mercer because this program is known for educating academically strong and clinically skilled therapists. I am so happy to be here. I'm thankful beyond words to become the Children's Healthcare of Atlanta Therapy Scholar. Words are truly not adequate to express the appreciation I feel. I believe it is a miracle. I fully embrace the expectations to live and work in a rural area and see families with children. Those expectations are my dream. I want to help underserved rural communities in clinically integrated practice. I do not take this opportunity for granted. I almost didn't pursue my education because of the expense and the inability to find resources. I almost didn't apply for the scholarship as I always felt unworthy. I stepped out on faith, and thanks for the encouragement of my mother, Sharon Robinson, and my pastor, who I brought with me today, Pastor Dexter Maxwell, I became a student and I applied for the scholarship. When I received the call that I was selected, I almost could not contain my composure. I am sure I speak for all my fellow MFT scholars when I say I am determined to use our education to improve access to mental health in rural Georgia. I was drawn to family therapy for many reasons. My sister's husband died in a tragic accident. Heartbroken, she could not find any reason to go on. I watched as the trauma almost took her away. I tried to help her, but I felt inadequate. To my surprise, she told me one day that the reason that I was there for her, it meant everything to her. About the same time, my father was diagnosed with a rapidly progressive dementia. As difficult as it was for my family, we finally came together and placed him in the Georgia War Veterans Home. Though he receives wonderful care and he is happy there, it was a difficult and divisive decision to make for my family. I wanted to know how to help more effectively. Lastly, I had married a man who I failed to realize had severe mental health issues. He was abusive. Ending that relationship was very hard, but the experience truly helped me understand that therapy, when needed and done properly, is therapeutic and life-saving. I have always wanted to be the person who helps other people. I have always tried to serve those in need. This is my calling. Family therapy, this is definitely my calling. This program will give me the knowledge, understanding, and skills so I can desperately do what is needed and for those who deserve it. I'm a youth pastor at my church. We are in a stressful world and children and adolescents, and we need to do better. We absolutely must do better. There are so many children with behavior issues and little support. Children with behavior that suggests autism wait well over a year to be tested for diagnosis. If diagnosed, they often have no way to access covered services because they are not available locally, may be of poor quality, and again, the wait is just very long. Wait times and quality of care for these children are not just the way it is. What it is a brain and potential loss. We must and will make it do better. This area is my heart. And it is the heart of my fellow students. Our goal is to be trusted resources for our communities and families in need. I am definitely a positive person. I believe most problems can be solved if we work together and each of us share the responsibilities to find solutions. Today, it is a testament to what happens when people care about making the world better, when people care about solving problems, and most importantly, when we all care about each other. Thank you again, Mercer University and School of Medicine and Children's Healthcare of Atlanta for caring and making this possible. We will not let you and rural Georgians down.
Thank you, Lakeisha. That was excellent. I want to thank all of you for being here, and thank you to the families of the scholars and your support for future physicians and therapists. I hope you sense the commitment these young people have to this state, to rural Georgia, and to make the difference that will come in the state of Georgia. Thank you to Children's Healthcare of Atlanta, Donna Highland, Dr. Fortenberry, Mark Welsh, Linda Masakai, and Dr. Greenbaum, and so many others who I failed to mention, but you know who you are. You've made such a difference. At the quote, Lakeisha, this scholarship is a miracle. It is. And Mercer is about rural health. We have fought this fight for many years. This scholarship is helping make a dream for children possible in these rural communities. We'd also like to thank our state leaders who support the School of Medicine, who support good programs in this state, and who care about rural Georgia. And I'd like to thank our leadership at the university. Mercer is devoted to service. We're devoted to a good education too, but changing our world for the better is who Mercer is. I can't think of a better example of how two organizations come together to change this state. I thank the students for being here, your families. Thank all of you who put this luncheon together. I have to recognize Terry Walker, who made this possible. Terry, stand up, because you work so hard to make things happen. Thank you for being here. I would say that if you wonder what the posters are in the lobby, this this effort with children's, part of that is the scholarships. The other part is a huge initiative that's going on in the state. In, I think, 13 rural hospitals now, about 16 pediatric offices. We're working in mental health in public schools and private schools across rural Georgia. We're working in emergency rooms in rural Georgia to help improve the care that children could access in those communities. We're working with pediatricians to bring them resources and to be able to connect to a telehealth unit. If you go to your pediatrician and they need follow-up for strabismus, you can actually do that through telehealth. We're placing that equipment. All those projects are done with work from MRSA and funded through this children's initiative. So when you leave today, just be grateful that we have Children's who wants to help change rural Georgia for better. And remember that as you go through your community. I suspect many of you come from communities where we're working, and it wouldn't be possible without a partner like Children's. Thank you for being here. We're honored to have you. We're honored to have the young people that you're here to support, parents and loved ones, because they're the best of the best. So thank you again, and you're dismissed.